COVID-19 labor and delivery, labor to cesarean. Please note that the recommendations in this video are based on the best available evidence that was present at the time of filming. Please remember to consult with the Centers for Disease Control, your national governing bodies, and your hospital leadership for the most current recommendations. The objective of this video is to provide concrete and memorable examples of the 7 principles of safety. Number 1, safe entry. Donning PPE in the proper manner prior to entering a room protects staff. Number 2, safe transport. Moving a patient throughout the hospital requires careful management of protective equipment. Number 3, safe labor. The most important thing is to avoid a crash cesarean. This may require a lower threshold for C-section. Number 4, safe surgery. Everything should be done to avoid the need for intubation. Number 5, safe baby. Separation of 6 feet is recommended. Number 6, safe staff. Minimal staff should be present and interactions should be minimized. And number 7, safe stuff. Conserve personal protective equipment.
Hi, is this Hannah?
Hi, yeah.
Calling to give you some pre-arrival instructions for your induction tomorrow.
Awesome.
Any problems with this pregnancy so far?
Well, I'm quarantining at home right now for being COVID positive.
Okay, so you are positive.
Correct.
And you're quarantining at home.
Correct.
Okay, very well. So when you do arrive tomorrow, you are scheduled for 8 o'clock. We would ask you to please wear your mask on the way in the door, just for your safety and the safety of everyone here.
Okay.
And do you have any questions for me?
No, I can't wait to see you guys.
Well, we're looking forward to seeing you tomorrow as well. And Dr. Karen will be here for you, and we're all here for you. And if you have any questions, you may call us back.
Thank you so much.
Oh, you're welcome. Have a great day.
You too, bye.
Bye.
Later that night, Hannah's water breaks at home. She comes in around midnight instead of her morning scheduled induction. She has been self-quarantining at home since her positive COVID test 7 days ago.
Hi, how are you?
I'm fine. I think I broke my water.
Okay. Do you have a fever?
No,
Cough?
no, but I did test positive for COVID-19 last week, so I need a mask.
Okay.
Thank you.
There you go. Please place the mask on now and wear it at all times.
The most important mask in this situation is the mask that goes on the patient.
Hi, oh my gosh, I'm so glad you're here.
Good to see you.
Yeah, you too.
Hannah and her husband haven't seen each other in a week and a half. Here, they continue to maintain social distancing.
Labor and delivery, this is Betty.
Hi Betty, it's Pat. I have a pregnant patient here with COVID-19. Her and her visitor are out front. Her water broke. They are both masked and ready to go directly to a negative airflow room if available.
I copy that. You have a pregnant patient suspicious of COVID-19 with her one visitor out front. Is she masked?
Yes, she is.
I have my surgical mask. I will check that room 208 is available. Yes, 208 is available. I am coming to get the patient now. Jenny, I designate you to be her labor nurse. Please go to the room 208 now and remove any precious supplies, as they will all need to be discarded when the patient leaves. Please cover the screens and keyboards with saran wrap.
Safe stuff means protect hospital supplies. Disposable items that are exposed to a patient would need to be discarded otherwise.
I'm going to the front desk to bring a pregnant patient with known COVID-19 with her one visitor to negative airflow room 208. Because I anticipate my contact with the patient to be greater than 2 minutes, I have my mask. But because I don't anticipate your contact with the patient to be greater than 2 minutes, you do not need a mask at this time.
Here's your mask in case your interaction is greater than 2 minutes.
Thanks, I'm okay. I have mine on.
Okay.
Hi, I'm Betty. I'm going to take you and your support person to your private room to be evaluated. Please, both of you, keep on your masks at all times. Ready? Okay, here we are at room 208. I'm going to have you go into the room, have a seat on the couch, and while I notify your care, please keep your masks on at all times, and please close the door behind you.
Okay, thank you.
The door is closed. I am turning on the negative airflow. I've just got to put up the restricted access sign and the employee log. Hi, Dr. Emer. I have a pregnant patient positive for COVID-19 in room 208 with her visitor who broke her water. They are both masked, doors closed, the negative airflow is on, and restricted access sign is up. Employee log is also up. I have designated Nurse Jenny to evaluate her. Proper triage and PPE protocol has been used. Which physician would you like to designate to evaluate her?
Thank you. Because I have a contraindication to evaluate a patient, and because Dr. Taverna has no contraindications to evaluate a patient with COVID-19, I have selected her to evaluate and deliver the patient. Do you agree?
Yes, I agree. Thank you. Please now have your team notify the ID physician on call. I will notify NICU.
I'm sending a tiger message to our COVID-19 on-call team.
I'm going to call NICU. Hi, this is Betty from Labor and Delivery. I was just calling to inform you that we are admitting a patient that is positive for COVID-19, and we will be admitting her in labor.
Thanks for letting me know. Please keep us posted throughout her labor course. When you get close to delivery, we will make sure that we have the minimum staff available to be able to attend the delivery.
Safe staff means minimum staff. Sending minimum staff to a delivery minimizes exposures.
And do immediate temporary isolation of the neonate, who we will treat as a person under investigation.
Okay, thank you so much.
Betty, I need to be fit tested because I'm going to be in the room with her.
Okay, I'm going to be calling the supervisor and I'll let her know that.
Thank you.
This is Betty from Labor and Delivery. Please can you come and perform just-in-time fit testing for my 2 staff members who will have extended contact with the COVID-19 patient.
And so you're gonna keep that mask.
Jenny, we should go eat something before we put on our masks and go in the room.
Sounds good.
Now I'm going to take off my coat and my earrings to get ready to put on the PPE.
Me too. I'm going to take my headband off. I'm going to go get the nourishment.
Forceps just in case.
Personal protective equipment includes gown, mask with face shield, and gloves. While a surgical mask is considered acceptable masking for birth, our administration is supportive of use of N95 for a birth admission of a COVID-19 patient or PUI for use by the dedicated care team, nurse and physician, for several reasons, most notably unpredictability of patient mask adherence, potential for cough, potential need for supplemental oxygen as maternal respiratory support, potential conversion to cesarean, and potential conversion to general anesthesia. That looks good. That looks good. Now back to the principle of safe entry. Proper donning of PPE, cross-checking of one another, and double-checking the negative airflow are crucial steps before entering the room.
I think I'm clear, am I?
You're clear. Am I clear?
Yes, you are clear.
Let me check the negative airflow. Yep, it's on. Good.
We are properly protected. You can go in now.
Hi. I'm Jenny. This is Dr. Taverna Miller.
Hello.
So I'm going to check your vitals. I'm going to put an IV in and draw some labs. I'm going to get a CBC with diff, lactate, propel, CMP, AVO, RPR. Then I'll connect you onto the monitor, and I did bring a drink for you too, just to sip on. And as a reminder, do not leave this room unless we are with you. Okay.
I know this is a scary time, but I just want to let both of you know we're going to take great care of you and keep you informed of all the steps along the way.
There are a couple of things we want to go over before things start happening. First, we are grateful for your trust, and we promise to take great care of you and your family. We will always be there for you at this difficult time. This is a joyous event for your family. You're the most important person to be masked. This not only protects you and your family, but also our staff, who is at great risk. We insist that you keep your mask on at all times even though this may be uncomfortable. It may save our lives. We will support you in labor and ask as much as you can to keep staff safe by minimizing respiratory droplets, avoiding spitting. We urge you to consider early epidural even if it wasn't part of your birth plan. Pain control may lower the risk of coughing, and that may actually make it easier for you to breathe. We encourage you to consider epidural early on in labor because if cesarean delivery is necessary, and epidural will lower the risk of needing a breathing tube, which would become life-threatening. We will do everything to avoid a cesarean section for you. We especially need to avoid an urgent or stat cesarean delivery for you, as this would become life-threatening. Know that if we recommend cesarean delivery, it is only because we think it is the safest way for your baby to be born.
We will respond quickly to your calls for help. One of the ways to prevent us from catching this virus and spreading it to others is to have all our protective equipment on properly. This can take some time to put it on correctly, and in order to arrive safely to you, it may take longer than what you would normally expect. Birth will always continue to be a beautiful, life-altering, and meaningful experience. It is very unnatural for us to have to treat it in this sterile, covered, protective environment. We wish it were not this way, but we are willing to do whatever it takes to keep you and your family safe. It may be very emotionally difficult to be physically separated 6 feet apart from your new baby immediately after birth. This separation is temporary. This goes against everything we have previously worked on to achieve, which is close mother-baby contact. We do this under recommendations from national organizations like the CDC and take these recommendations very seriously. The purpose of immediate and temporary separation is to reduce the risk of transmission of the virus from you to the baby. If breastfeeding is important to you, we will absolutely support this. We will need to teach you to pump milk and use a special way to sanitize the breast milk collection parts. We are almost certain that your newborn baby will be born without the virus. Despite this, the neonatology team will treat your baby if she or he has it temporarily, but this is to make sure that we keep your baby as safe as possible.
Your oxygen saturation is 97%, so that's good.
All right, I'm gonna examine you now. I'm gonna first start by feeling your belly to feel what position the baby is in, and then I'm gonna check your cervix to see how dilated you are. And I can tell your baby is in a head down position, so we don't need to do an ultrasound to determine that. And now I'm gonna see how far dilated you are. Oh, wonderful. You're 4 centimeters dilated, 70% effaced, and -2 station. That's excellent progress.
Does that mean I can get an epidural now? Probably, but first, I'll give you some IV fluids. We need to have your CBC back because thrombocytopenia can happen with COVID. We're going to step out for a bit. If you need us, just reach us by calling the number on the board.
Thank you.
Okay, thanks.
As Jenny and Karen step out, let's review proper technique for doffing or removing PPE. The gown and gloves should be removed together, rolled into a ball, and discarded in the trash inside the patient's room. Keep your mask and face shield on while inside the room. In fact, you may have an opportunity to keep your mask and face shield on the entire shift. Please review this with your leadership team. If you need to remove your mask, handle it only by the ties or ear loops behind your head. Do not touch any outer surface of the mask or face shield. Carefully discard it in the trash. Wash your hands with soap and water for at least 20 seconds. 2 happy birthdays. And don't forget to sign your name on the employee log outside the door. All right, let's get back to Hannah and Chris, and Jenny and Karen, and that early epidural.
Oh my gosh, what a crazy time to have a baby.
This is unbelievable. I mean, I'm so glad they're taking these precautions, but this is
know.
just unbelievable. What a crazy world we live in right now.
Can't wait to see the baby.
I know. Little Rick.
Do you agree that we should get her an earlier epidural and not wait until last minute?
I think so too. It's a good idea. Dr. Pfeiffer.
Hi.
Hi. Our patient Hannah, who you should have heard about from SOD, would like an epidural. Karen, I think it's a good idea to get one early because our main goal is to avoid a stat or crash section.
I agree. I'll call the patient to minimize our contact and I will obtain verbal consent. Hi, I'm Dr. Pfeiffer. I'm the anesthesiologist on call today. I'm going to be putting in your epidural. I'm going to go over the consent form over the phone with you. Let's discuss the risks, benefits, and alternatives to an epidural. You're a great candidate for an epidural, Hannah. As soon as your CBC comes back, I'll come put it in.
All right, guys, I just want all of us to get together and touch base and have a huddle about the patient in 208. She has been laboring, and I think it's time for her to get an epidural, and I wanted to talk to you all about that.
Yeah, I agree. I obtained verbal consent from her. It looks like her most recent platelet count was 133,000, which is acceptable for an epidural.
It's time to talk about another principle of safety, safe labor. Hannah has some fetal heart rate changes, and Jenny and Karen do everything they can to try to avoid a C-section. Here they are reviewing the fetal heart rate tracing just after the epidural.
I'm not liking the strip, Karen. What do you think?
I agree. It's category 2, and we need to do something different. I would like you to go back in and check on Hannah. Do not apply oxygen for the purpose of category 2 tracing because there's no real benefit and there is serious potential harm of aerosolization. Make sure she doesn't have hypotension. If her tracing doesn't improve with usual measures, she will need a controlled cesarean section. We need to avoid an uncontrolled stat or crash section at all costs. I will stay out here and watch the tracing from the workstation.
Absolutely. Your baby's heart rate has some concern, so I just wanted to turn you on your side just a couple times to see how that helps, okay? So I'm just gonna have you face the window. Your blood pressure is fine, and your oxygen saturation is okay too. Baby's still low, so I'm gonna ask Dr. Miller for an IUPC.
Okay.
Hi, Dr. Sharona Miller. I'm not getting any improvement in the variables. What do you think about an IUPC?
I agree. I've been watching the tracing for 15 minutes out here and they are getting deeper. I'll come down because I do not know what supplies you normally need for an IUPC. Tell me what you need. Hello? Here I have the supplies we need for the IUPC. Oh good, the IUPC is in. You have made some change. You're now 5 centimeters. We're gonna watch the baby's heart rate for the next few minutes, and then we'll continue to watch you carefully. Hammer, can I run this by you? I have Hannah here with COVID-19 with the category 2 tracing. I've done what I feel is safe to do to improve the tracing, but it's getting worse. I think I should section her. What do you think?
Karen, I agree with you. It's far better to have a controlled cesarean, perhaps a little earlier than you otherwise might call, than a stat C-section, because that could be disastrous. You will need a second surgeon. I will call Melinda in to scrub with you. I will also have her just-in-time fit tested. I will notify charge to begin preparations for a cesarean. Remember, do not rush these next few steps. Correct transport of these patients is essential.
Let's go open the OR. We've got the count.
Okay.
So Hannah and Chris, I think we need to proceed with a C-section because of how the baby's heart rate looks. And I think it's best that we do this now rather than wait for it to be an emergency. Do you have any questions?
Could you please take my phone and film the birth so I have records of it?
Unfortunately, no, I can't bring the phone in because it's contaminated.
No.
No, we just want the baby to be safe.
Absolutely.
Let's get ready to roll.
Since we are both going to be touching the bed, let's keep our PPE equipment on.
Okay. Charge, we are ready to exit the room. Have you notified NICU of the impending section?
Hi, NICU Charge. We are going to be going to the OR in a controlled fashion for delivery of a COVID-positive mother. We are anticipating immediate temporary isolation, and mother has been prepared for this. Please send your team.
I copy that. You are going to the OR for a controlled cesarean for a 41-week known COVID-positive mother.
Our protocol is for the OB team to supply the baby nurse, who is designated to catch the baby and bring him or her over to the awaiting NICU advanced practitioner or neonatologist. Later in the video, you will see that we filmed with NICU catching the baby, but that would only be if OB could not provide the staff.
Please bring a clean gown to hand to me when I open the door. I would place it on her just before she rolls out of the room. I am leaving my PPE on because we will be touching the contaminated bed. I need you to operate the doors along the way. Do not touch the patient or the bed, and you must be wearing your mask.
The OR is ready. Let's go to the OR.
Bye, sweetie. I love you. Good luck. Good luck.
Okay, I'll get the doors.
Daddy, make sure you don't touch the bed or anything that's touching our patient. Thank you for getting all the doors for us. Okay.
In this video, we adopted the strategy of having the physician and nurse push the bed to the OR. This requires the physician to scrub over top her PPE, which, while seeming awkward, is acceptable. An alternative strategy is to designate a maternal transport team. However, this requires a separate team with their own PPE and requires the physician to doff her PPE in the labor room, run ahead to the operating room, scrub in, and enter the OR before the patient. Our strategy may change based on feedback or if additional guidance is released.
Melinda, we're ready to go into the operating room. We keep our PPE on as we enter the operating room, and we'll put our sterile gown and gloves on top of this.
Okay.
Staff members who enter the operating room before the patient may wear a normal set of sterile gown and gloves. Staff members who enter the operating room after the patient should don their sterile gown and gloves on top of their regular PPE. Don't forget to cover computer screens and keyboards with cellophane wrap.
All right, everybody, we're gonna do our roll call. I'm anesthesia.
Surgeon,
Scrub tech,
Circulator,
second surgeon.
NICU.
Does everyone have their N95 mask on?
yes,
Does the patient have a surgical mask on?
yes.
All right, we can do our timeout.
So this is Hannah. She's full-term pregnancy. COVID status is known positive. We are doing a C-section for a category 2 fetal heart tracing. As part of our timeout, we review our critical steps. Neonatology, what is the plan for the baby?
So after baby is delivered, I will take baby to the radiant warmer, at which point we will proceed with temporary and immediate separation of a minimum 6 feet distance between mom and baby.
Okay. Clamps, no delayed cord clamping, guys.
The principle of safe baby is that baby should be separated from mom by 6 feet or more. This separation is immediate, but also temporary.
So Melinda, we're finished with surgery, so we have to take off our sterile equipment in a special way so that we maintain our underneath PPE. So we'll take our gown and gloves off here without removing the yellow gown that's underneath. And then we'll exit the OR. Next, we'll take off our yellow gowns. Now we're going to wash our hands, and then we'll check each other's masks to see if they've been soiled.
We do not consider cesarean to be an aerosol-generating procedure, so the physicians can leave their N95 mask on after a cesarean. However, if the N95 is splattered with blood during a cesarean, it will need to be removed as per the guidelines.
So we washed our hands, and now we put new gloves on before we take off our masks. So Melinda, we try to save our masks if we can. So I need you to check my mask to let me know if it's been soiled. Do I have anything on my mask?
Nope, yours look clean.
Melinda, you do have blood on your mask, so we need to remove that and discard it in the appropriate way.
Okay.
If goggles are physically intact but soiled, they can be cleaned with 70% alcohol solution or stronger and reused indefinitely. As always, the final step in doffing your PPE is washing your hands with soap and water for at least 20 seconds. Now let's check back with Hannah and Chris and see how they're doing. Hannah stayed in the operating room for her entire recovery period, but when it was done, she was able to go back to her room.
Congratulations! You did it!
How you doing?
He's here!
Doing okay?
Yep.
Oh my gosh. So happy to see you.
Me too.
No PPE was harmed in the making of this film.
Thank you for watching this COVID-19 labor and delivery simulation. Thank you to the St. Luke's OB team for volunteering your time and energy in making this video. And thank you to healthcare workers everywhere for your dedication and bravery in these unprecedented times.